which they can be a part of our mission to find a solution and to be encouraging towards efforts that are being met to reach that goal. Today, we have the opportunity again of being able to speak with a preeminent uh, professional in this area. Uh, Dr. Brian Strom has been very candid and very gracious to come involved with us on, the grassroots level to discuss an issue that many of us are passionate about and many of us are still confused about. And we're very happy about the relationship that we have built with him, and we want to continue to encourage it. And along with that, we've been able to find an opportunity to share with members of our community, and particularly individuals that have become important in my life, to become a part of this conversation. They have been survivors of the pandemic and will give us some fruitful information and understanding on why it's so important for individuals to adhere to the recommendations that our medical professionals are giving to us, and to also understand why a number of the activities that are going on in our community by our elected officials are so important for us to understand and be obedient towards supporting. Uh, Today, we are able to do this outreach services through the Facebook channel, the image profile report, and on my website, herbglenn.com/live stream. When my live stream advocate comes on, which is my son, and I'm not sure if he has gotten here yet. But in the meantime, I'd like to introduce Dr. Brian Strom. Dr. Strom, obviously, there are a lot of things going on, many changes that have been done, uh, things that need to be articulated a lot clearly. Um, I hope that you can be able to share with us some things that you find that are really evident of needing to be heard from your community. How are you doing today?
So I'm doing great. I hope everybody else is here as well, particularly the people who've recovered from this bad disease. Um, what else? I think the thing for sorry, that's the nature of being home. My wife will answer. Hopefully she'll answer. Um, the as people probably know, New Jersey has gone from being the epicenter of the world in terms of the to really doing incredibly well, and really much better than people even realize. There's a long lag time in this disease between when people start to get infected, when other people, they infect other people, they infect other people, people get symptomatic, the symptomatic people get really sick, and so on. And so what we're seeing in the data now, and New Jersey, New York, Massachusetts, Connecticut are really standouts. We are now an island of doing extremely well, where the rest of the country is doing horrendously, and it's because people are, I have to credit our government officials did the right thing. They asked for the right thing. They continue to do the right thing, and the public continues to follow what they want to do, what they ask us to do. This is a new virus. We've learned a lot about the disease as time goes on, with a lot more yet to go. Will we develop a vaccine? Will we have treatments? All of that remains to work out. But with most viruses, people are contagious when they're sick, which is part of why people were told early on, don't wear masks, because it's not necessary. If you're not sick, you're okay. And we needed the masks for the healthcare workers in order to provide protection for the healthcare workers. What we have found since is fully 1/3 of people who get infected don't get sick at all. And people are the most contagious just before they get sick as well. So people who are asymptomatic or pre-symptomatic, as it's referred to, are the people who are most likely to spread the disease. And what that means is the only way to prevent spread is wearing masks, because you don't know who's sick and who has it and who doesn't have it. So you really need everybody to wear it. But it's worked. I mean, as a field, we are happy if in testing, about 5% of tests are positive. Here in New Jersey, it's only about 2 to 3% are positive. You're happy, there's a figure called R0. R0 is the estimate of, for every case, how many other people do they infect. At one point in New Jersey, it was 5.5, that every case infected 5.5 other cases. Now it's about and a little bit less than 1 still, which means for every case, a little bit less than 1 new case gets infected. So our epidemic, as much as it's in control, is shrinking rather than growing at the same time as the rest of the country is exploding. And so it is because our political leaders have asked us to do the right thing, and the people of New Jersey are responding accordingly. Very important, distancing, masking. New data have shown how important they are. If people are even 3 feet apart, it dramatically reduces risk. People are 6 feet apart, it reduces risk a lot more. 9 feet apart, in theory, should reduce it more. We don't have data to prove that. People who wear masks markedly decrease risk. And masks plus physical distancing, it decreases it even more. So, the bad things is getting together as groups, whether in political conventions or political meetings or otherwise, are a great way to spread the disease and make people sick. Getting together on beaches, if you don't allow distancing between you, indoor gatherings, so particularly bars, indoor restaurants, those are great places to spread the disease. Bars, restaurants, you're eating. It means you're not wearing masks. And then on top of that, you're talking, which means, and maybe even talking loud, which means you're spitting and spreading the disease. So indoor bars, indoor restaurants, indoor activities in general are really problematic. But again, New Jersey is in great shape now. That won't continue, unfortunately, because we will be contaminated by the rest of the country and by young people who unfortunately are going to beaches and bars and not being protected, and they're taking risks that the rest of us will suffer from.
Are you suggesting, obviously, that there may be a possibility that the impact of the virus would not be as severe as it has now affected other parts of the country?
I think as long as we do the right thing in New Jersey, we will never again be as bad as we were in the spring. Um, it'll get worse than it is now, but I think if we continue to do the right thing, it will never again be that bad. So again, it'll get worse. It'll get worse in the next few weeks. It'll get between the July 4th weekend, all the weekends at the beach that people have been spending without masks and so on, and the contamination from the other states. But I think what you'll see over the course of the next months or years is basically a zigzag. Sometimes better, sometimes worse, sometimes better, sometimes worse. When things are better, the economy will get released. When things get worse, the restrictions will get stricter again, and hopefully we'll go back and forth, never going back to where we were in the spring, which is where Florida and Texas and Arizona are now approaching as they go forward.
With the way in which we have been able to um, notice that the changes are occurring because people are being obedient and they're changing their lifestyles. The concern is definitely with the possibility that if you are infected and you survive it, that you can still be able to transmit it to other individuals. At one point, we were told that that wasn't true. Now they're saying that it is. Is that the truth?
Yeah, so let me tease out a few things in there because that's a great question and there's not a simple answer to it. Um, in most viruses, if you get infected, you develop antibodies and you can't get it again. That's true in about 95% of viruses. There's 5% where that's not true. And included in that 5% are other coronaviruses. So we don't know yet whether antibodies will be protective or not. What the data that are beginning to come out are that if you develop antibodies, they may only be around for 2 or 3 months. So if you got it once, can you get it again? Maybe. There are cases that look like they've gotten it a second time, but there aren't that many. We just don't know yet. And so, we know that people who are sick, most of them develop antibodies, but not all. We know that people who, in other diseases, antibodies are protective. We don't know that antibodies are protective in this disease, and we don't know how long they stick around. Other than it looks like it's relatively short term, 2 or 3 months. The other thing is there's another entire part of your immune system that is not antibodies. It's referred to as cell-mediated immunity. It's where your white cells attack directly attack the infection. And cell-mediated immunity also might be useful here. So even if you don't develop antibodies, cell-mediated immunity may be useful. We just don't know yet. The disease hasn't been around long enough, and we just don't know to know that. We do know now, just data that just came out last week, that the virus does trigger cell-mediated immunity. Is that, if you get sick, is that cell-mediated immunity protective? We don't know. So for people who've had the disease before, still protect yourself. We don't know whether it'll be protective. If in fact these things, if antibodies don't continue and aren't produced enough and aren't protective and don't continue, and cell-mediated immunity doesn't work, it also means a vaccine won't work. And so we just, it's too early. We just don't know. So what's clear is if the first 3 vaccines that are being tested, and we're actually involved in testing 2 of them at Rutgers, if you give the vaccine to people, they develop antibodies. We don't know that those antibodies yet. We don't know those antibodies are protective, and we don't know how long those antibodies last, other than the fact that based on other experience, we would guess they only last 2 or 3 months.
Well, if you're tuning in, this is the Image Profile Report, and I'm your host, Herb Glenn. Today we have a panel discussion in relationship to the COVID pandemic, and we have our resident expert, Dr. Brian Strom, who's here from Rutgers BioMedical. We also have with us today a contingent of 3 individuals who are survivors, and we'd like to hear a conversation through them as far as their experiences and what it is that they feel should be part of a understanding of how important this is. Today we have Ms. Lynn Wilson, Ms. Christina Hagelin, and Ms. Kendra Palmer. And I'd like to start first with Ms. Wilson. Lynn Wilson is the professor that I am studying biology with this year. And when I shared with her the importance of this conversation, she wanted to share with us her experiences. Ms. Wilson, are you on the line?
Yes, I'm here.
All right, great.
Yeah. Well, yes, thank you for inviting me, first of all. And it's an honor to be on the panel with Dr. Strom. It is, let me just tell you, it has been an experience as far as my experience with COVID. It wasn't just my experience, it was also my husband's experience. Just to give you a little bit of a background on both of us, my husband, I'm going to talk about him a lot because he actually had it worse than I did. He is immunosuppressant. He is immunosuppressant because he is a kidney transplant patient, and was doing well for exactly 1 year. He's had the kidney for 1 year, and then COVID happened, and COVID tried to destroy that kidney. And it was a fight. I would say right after diagnosis, maybe on the 16th, April 16th, we were asked to quarantine. First, let me tell you, we thought we had colds, simple colds, sniffles, a little bit of coughing, and that was it. But my husband's cold seemed to get worse. And as it got worse, he decided, let me call my doctor. And his doctor suggested strongly that he go get tested. And I went with him. And so we both were tested, and then we both found out that we had COVID, okay? He probably was the first to actually get the virus because he's a substance abuse counselor, and he's working with a particular clientele that his transplant doctors were a little adamant about, a year ago, like, are you serious? Because he doesn't have an immune system or a strong immune system. And so you're exposed to everything when you're in that line of work. And sure enough, it happened. He had COVID. We both were quarantined for 14 days. We were told to stay home, Don't do anything, don't go out, have people deliver food to you. We did all of that. 14 days. I got better. He did not. And so the last call from his doctor, who had had some blood work requested, and they did it in home, saw that his kidney function was deteriorating. And so therefore he said, you need to get to a hospital immediately. And that was it. So from, I'd say, the last week in April to March 15th, he was in the hospital. He spent 2 weeks there. So all total, he spent a month with COVID, maybe a little bit longer. And it was a trying experience. I, on the other hand, developed a red spot in my eye, my left eye. Actually, it was a series of spots that were sort of like it took on a square shape. I don't know, I'd never had that happen before. And then from there, it got worse. Literally, I couldn't go up or downstairs without being out of breath and nearly passing out. And this was sort of, it was horrible in that he was now in the hospital and I was in the house by myself. And this was, I have to say, it was the worst experience ever. I had nightmares that were graphic. I would wake up in the middle of the night and my heart was racing, and at least twice I thought I was gonna die. I really did. Then I developed a tingling in my left leg. And for, I would say about a week after the diagnosis, this was my existence, okay? Shortly before my husband went into the hospital, I started getting better. And as I got better, I started to do more and more and more, but as I tried to overdo things, I actually set myself back a couple of times where it felt like I was starting all over again. Fast forward to now, we are much better. He is phenomenal. He's been out of the hospital. He's doing what he normally does. He's a musician, so he actually teaches a class in music. But me, I'm actually having side effects. I'm having that tingling in my leg has turned into a sciatica-like condition where my back hurts. My left leg tingles. It's sometimes very numb, especially in the morning. I have to move around just to make sure that that feeling goes away, or hope that it goes away. And I found out from one of my students today that, yeah, hair loss seems to be another issue because I'm losing clumps of hair, as she'll tell you herself. And so, yeah, I'm still dealing with COVID in my own way. I'm still dealing with the side effects. I don't think a lot of people are aware that even after COVID, you're still going through COVID, okay? I have a tickle in my throat that makes it impossible for me to talk for long periods of time, and it's really difficult if you are a teacher. And so it's, like I said, it's continuing. It has not stopped. It's much better now. And I'm very aware of my surroundings. I was before, but even now, so, you know, I'm very aware of people who are not wearing masks. And I'm saying in my brain that you really need to take this serious, because it is not a hoax. The pandemic is real. Wake up, people, wake up.
Do you have a question that you would like to ask Dr. Strom?
Yeah, I'm actually more, when my husband was in the hospital, one of the things that they wanted to give him, they had to get my consent through the Mayo Clinic, was a consent to give him convalescent plasma. So I wanted to know, because I've been hearing some things where it's not beneficial, but then in the beginning we heard it was beneficial. And I actually try to donate, but that fell through for another reason. And I would still like to do it, but does it work?
Simple answer is we don't know yet. One of the frustrations, because what convalescent, just to make sure for the audience sake, obviously you understand this, the convalescent plasma is taken from the blood of people who had COVID before this.
Right.
And it's thought to be You take out the liquid in the blood, you concentrate it, you get concentrated antibodies, is the idea. So you're giving people the antibodies from people who had COVID. It's a treatment that worked in Ebola. It's a treatment that works in a lot of other conditions. And it makes sense as something to try, but there's yet to be a definitive study that shows it works. I can tell you in our experience, it's so far hasn't been working extremely well. But it's not definitive. You know, you really need a clear controlled trial with a placebo group that people get. We have that underway now, so we don't know the results of that study yet. And you need to make sure also that the convalescent serum that you're giving has concentrated antibodies. So you want to be able to measure the antibodies in it to know. Early in the epidemic, we couldn't do that. Now we can do that. Measure the concentrated antibodies, give it to half of the people randomly assigned, half of the people get it, half of the people don't get it, and look to see if there's a difference between them in outcome. And there are a number of such studies underway at Rutgers and elsewhere, and we just don't know the answers yet. There's good reason theoretically to think it might work, but again, if antibodies aren't protective, like I was talking about before, if antibodies aren't protective, then it's not going to work. And so we just don't know yet. The studies are underway to determine that.
Wow.
Okay. Can I ask who's doing the study specifically? I mean, what is the Mayo Clinic's role in this, in that I had to sign a document that had to be then sent to the Mayo Clinic?
So we're doing it at New Jersey Medical School.
Okay.
Mark Klappholz is leading it. Mount Sinai is doing it. Whoever your doctor was must have had some connection with Mayo Clinic. They must have had a study. And so because it's not an FDA approved treatment, they look to have you as part of that study.
Okay, all right.
But there's a bunch of those studies underway around the country, and I'm sure in other countries also, because it makes sense it might work, but we just don't know yet.
Well, I will tell you that he actually, when he got the plasma, he was also supposed to get the one that starts with an R, remdesivir.
Remdesivir.
That never happened. There was some kind of problem with getting it into the hospital. But St. Barnabas was the hospital, or is the hospital. But almost, I would say within a day or two, he began to feel better. Now, that could have been wishful thinking on my part, or he's just that person.
Yeah, so you raised two important points. One is, statisticians call regression to the mean. Physicians rely on regression to the mean. So if you have a headache, sometimes it's better, sometimes it's worse. When are you going to go to the doctor? You're going to go to the doctor when the headache's at its worst. No matter what the doctor does is going to fool the normal return to the normal pattern. Is going to look like an improvement, fooling both you and the doctor into thinking that it helped.
Right.
That's why you need a parallel controlled study where you have a group that isn't being treated along with it. But the other interesting part of the story you described, and the other reason why you really need to study convalescent serum rigorously, is COVID is a fascinating disease in lots of different ways. One of the things that's clear is people get really sick with it, have a 2-phase illness, which it sounds like your husband had. It looks like they're getting better, and then suddenly they get worse again.
Yeah.
And in that second phase, it's the immune system overreacting. So, and it's the overreaction of the immune system that seems to be causing that second phase illness, which is why recent data just came out of Oxford a few weeks ago, that if you give people corticosteroids, which are immune suppressants, when they're sick, it actually reduces mortality 30% because it's getting at that second phase. What we don't know is if you give it early, is that even better, like a lot of treatments would be, or might that be worse because now you're suppressing the immune system when you need the immune system to fight initially. Same thing with the antibodies. The convalescent serum was saved for people who were sick toward the end of their illness, which makes sense. But even if it doesn't work then, if you give it too early, it might do harm because it might take people who would have recovered anyway and given them a second phase of the illness that was more severe.
Wow.
Wow.
And there's a concern about the vaccine the same way. Is might the vaccine make people sicker rather than better?
Mm.
Which is why you need to study it in a large number of people to find out. This is just this is by definition a novel virus, meaning it didn't exist. And we have lots of coronaviruses that we're exposed to all the time. They're colds, exactly as you and your husband experience. You just think they're cold. You never get them tested. You never get it cultured. There's no reason to. It's a cold, you get better. But this is just different than a cold, and it makes people sicker.
All right, Christina Hagelin is shaking her head attentively. She has had an opportunity to share her experiences on Dr. Oz and has been incredibly helpful in relationship to the professor and I in understanding how some of these issues are in relationship to probably a lot of side effects that are common. Christina, why don't you share with us your story?
Hi, everyone. It's really a pleasure to be here. Thank you for having me. So I had COVID, long story short, and it was probably the worst thing that's ever happened to me personally. When this all started and it came out, I was one of those people who said, no, this is no big deal. This is, the flu is worse. It kills more people per year. This is no big deal. And I mean, I love science. I study science, and it was one of those things. I was based on the facts at the time. And, everyone was like, oh, you're wrong. This is going to kill everyone. I was like, no, you're wrong. And I got proved very wrong. I am 22 years old. I do have some comorbidities. I have mild to moderate asthma. I do have an autoimmune disease, although it is extremely mild. It is almost undetectable. It was something that I never worried about unless I had a flare. I'd take some steroids and I'd be done. And it was just one of those things. I was not scared. About a week before I started showing symptoms, I had a friend here from California. I was hanging out with everyone, no social distancing. And the weekend, before on a Monday when I started showing symptoms, that weekend I was with 12 people in a shore house. We're sharing drinks, we're eating food together. And it was one of those things that on Monday morning, I said to my mom, I have chest pain. And she was like, well, you were sick about 3 weeks ago. It's no big deal. You're probably just dealing with some allergies now. Went on through the week, started to spike a 103-degree fever, called my doctor, and he said, I'm thinking you may have picked up something bacterial after having this viral infection. I don't think it was COVID, no big deal. We'll take the antibiotics, see how it goes. And by Friday, I could not breathe. I was coughing up a storm. The 103 fever was not going down. So he sent me to the hospital to get a chest x-ray, which was clear. But they decided to do the COVID test anyway. And the next morning they called me and they said, we just want to let you know you are positive for COVID. Please stay home, self-isolate so that you can reduce the risk of infecting your family. If you do have trouble breathing, please come back. And it was one of those things that I was okay for one day. The next night I was having trouble breathing. And then the day after I felt like I was drowning and I was vomiting so violently that I could not catch my breath and I would start choking. So my parents were like, that's it. We're done. You're going to the hospital. We hate to do this, but you have to go. And once I was there, they took another chest x-ray to find that I had viral pneumonia. It started to get pretty severe. Within 4 days, it got severe. My oxygen saturation was at a 90 or a 91, so that's the reason that they chose to admit me. They had just put me in this room, and it was the craziest thing because they covered me in a sheet like I was this dirty person, and I could not be seen by anyone. And it was a horrible feeling, but I understand the reason why it did happen. Once I got in the room, I was fine. I could get up to go to the bathroom on my own. I was eating, although I couldn't taste anything. Everything tasted like the way that tires smell. That's what everything tasted like. And I was still eating. I was great. I was fine. And then things started to take a turn for the worse. My oxygen kept going down. My pulse was up in the 130s. It was terrible. I mean, I'm a person who has blood pressure 110 over, 70, and my blood pressure was 130 over 90. Like I was a wreck. And it came to a point where they had put a commode next to my bed for me to go to the bathroom. And although it was 1 foot away, I could not even sit up without my pulse skyrocketing and me being completely out of breath. And that was the point that they had decided to put me on a ventilator. I was on the ventilator for 5 days. When I woke up, I was shocked. You know, they asked me what day it was. I was like, it's Sunday, right? They were like, it's Thursday. And I had no idea what went on. And, you know, my parents were telling me things that I said before the vent because I had no idea what was going on. And unfortunately, 13 years ago, my brother passed away. And the one thing that I said to my parents was, if I see Jack, I'm going to tell him to screw off. And you know, it's like, why would I say that right before going on a ventilator? How is that the one thing that came to mind? And I mean, it gave us all a laugh. You know, my mom posted out on Facebook, got like 1 billion shares. Everyone was laughing. But the one thing I do remember was a nurse was holding my hand and she said, it's going to be okay. It's going to be okay. And it took a while for this memory to come back. And I said, I can't die. And she said, you're going to be okay. And I said, you don't understand. I can't let my parents lose another child. I cannot die. And she said, it's going to be okay. And that was the last thing that I apparently said to anyone. You know, when I left the hospital, or when I had come off the vent, I was there for an extra 4 days, which were horrible because I realized my right foot didn't work. It was swollen. It stopped working. And I was kind of devastated because I'm sitting there and I'm like, my foot doesn't work. They're like, it's okay. Like, you know, just, we're going to give it a couple hours. Could be some fluid retention, you know, could be swelling. We'll see what happens. And then they did bring in one of the doctors who was treating me. He looked at it, he touched it a bunch of times, and I told him, this hurts. This doesn't feel right. Something's wrong. And that was at the point that they had brought in a neurologist because they were afraid that I might have had a stroke. They did a CT scan. They did a bunch of tests. There was no evidence of a stroke. So they figured it was drop foot, possibly from the anesthesia, probably from not being moved enough. But they weren't too sure. They said, you know, you'll go home, you'll get some PT, in about a month or two, you'll start moving around again. And, you know, after I had left the hospital, I still couldn't breathe. I couldn't walk. I mean, it was god awful. And I'm lucky that I'm here, but I am still dealing with the effects of COVID. I have an ankle foot orthosis. This is my best friend because I still have not regained use of my foot. I have a sciatic nerve injury, and it is now being suggested that it is COVID related. So I am your medical research case. Everyone is studying me like it's nobody's business.
Wow, Christina, do you have a question you want to pose to Dr. Strom?
Yes, I was wondering if you have seen, you know, patients or evidence of patients suffering with neurological side effects.
Oh yeah, it's not one of the things that's striking about this disease. It certainly affects the lungs, and you gave an eloquent description of what people go through. But it doesn't always affect the lungs. And you know, different people are affected in different ways. I mean, just in your two stories, your kidneys, skin, neurologic side effects, absolutely neurologic side effects. Strokes, probably the thing in your eye that we heard about in the eye, that the little squares in the eyes, were probably from clots. It you know, somehow it causes people to form clots places that they otherwise didn't. And if one of those clots is someplace sensitive, like your sciatic nerve or your foot or some other area, it can have that people have strokes as part of it as well. I mean, and it takes people months to get better from this. This is not a short-term disease. It takes people many months to recover from it. You know, you're very, very fortunate given how sick you got. You know, especially early on, people will put on ventilators more quickly. And what we found is it can do damage to the lungs because your lungs get stiff. And then you put them on ventilators, and the pushing on the stiff lungs does damage. So now we don't use ventilators until later in the course of the disease. But asthma, by the way, interestingly, contrary to originally what we thought, isn't a risk factor. Just a paper out of Rutgers just last week. Chronic obstructive lung disease that you get from smoking is, asthma is not. And we don't know whether that's because, and it may actually be protective. We don't know whether it's because the asthma is protective or because the steroids that people get for the asthma, including the inhaled steroids, might be protective. We can't differentiate those yet. But again, we're learning a lot about it, but the simple answer is neurologic disease absolutely is one of the sequelae that people do get. You know, fortunately, we think most people ultimately recover from all the different symptoms, whatever it is, but it's still early. The disease didn't exist before January. So,
I mean, yeah, I find this absolutely crazy. And then I wanted to also ask, you know, I'm 22 years old. You know, do you see in studies that a lot of younger people are getting sick? I mean, I went into acute respiratory failure. Are we seeing that a lot in younger people?
we are seeing that much more now than we did early on. So early on, young people weren't getting sick, and still older people or people who are immunosuppressed who have underlying conditions, your autoimmune condition could well have been part of it. The makes people more likely to be sick and more likely to get seriously ill when they get sick. Young people thought they were protected, and relative to older people, they are protected. But in the last few weeks, if you look in Florida, if you look in Texas, if you look in Arizona, it's a huge number of young people. In part because they thought they're immune. They don't follow instructions. They don't do what they're supposed to. They get together in house parties like you were just describing, and not wearing masks and so on, and pass it to each other. So the proportion of young people who are getting sick is larger. So of all young people who get sick, a smaller proportion get very sick. But certainly, exactly as you're saying, the proportion of everybody who's sick with COVID is much higher now in young people than it was originally. You know, older people have learned to stay home and protect themselves and wear masks and socially distance. Young people still think they're invulnerable. So.
Wow. This conversation is certainly encouraging, and I want to make sure that I get enough time to get my panelists in, but I want to hear from this survivor, Ms. Kendra Palmer, who lives out in PA, Philadelphia, Pennsylvania, I believe, but I know she does live outside of New Jersey and has been very vocal in relationship to her concern of how important it is and for her to share her experiences. And Kendra, would you please share your experience with us?
Thank you for having me on, and congratulations to all the survivors. Um, I'm like get ready to get tears just listen to the stories because I was born with a kidney condition and COVID attacked my kidneys. So now, as a result, I'm on dialysis, and that's a battle in itself. Um, the pain in the legs. Today, I still have like my toes hurt. They have numbness and tingling. One of my hands have numbness and tingling in it. I used to be athletic. Can't do that no more. I get tired just doing basic tasks. So I try to stress the importance of people wearing their mask or just being protective of themselves because this virus, you don't know how it's going to attack you. You could be healthy or think you're healthy, and this virus, it'll eat you up. I know several people died from it, and some people who were struggling with it and had it a couple times, but it's nothing to play with, nothing at all. And as far as, oh boy, I look at this coronavirus like HIV. You have to think that everybody has it and protect yourself. And people are not taking it serious. What else could I say? My dialysis is something I have to do to keep myself alive until I could get a transplant. But it drains you. Like you could be good one day, you go to dialysis, then 2, 3, 4 days you might be down because it takes all your energy from you. And I lost my hair. It was falling out. I got dry and brittle and coming out in clumps. And I just cut it all off. It's coming back now, but that was one thing. I had like lesions on my legs, like dry skin patches. I never had no scars on my legs, and now I have like patches from the corona. Whew, so much. It's like I have memory loss. I had to do a CAT scan yesterday because I could be in a full conversation with you and then just my train of thought just goes and I'd be like, what were you talking about? So it's so much that this virus does to you that people have no clue. So I just wish that people would take it more seriously.
Wow. Can you pose a question to Dr. Strom?
Yes, I wanted to know, being that I'm on dialysis now and I have the antibodies, am I able to give my antibodies for other people to use it to help them out, or is that a problem being on dialysis?
The dialysis shouldn't affect that. It's, you know, we don't, as we were talking about before, we don't know whether antibodies are helpful yet, but
Okay.
if they are, you should be able to give to people.
Okay. Thank you.
We're going to be able to have a few minutes to engage a conversation with many of the advocates that we have in our community in relationship to the virus. We certainly appreciate the information that we have received, and I'm certainly sure that there's a myriad of different questions that can be asked. Let me start with Jose Ortiz, who was one of my first advocates online today.
Thank you. Thank you, Doctor. One of the questions that come to my mind, and we're talking about the vaccine and developing the vaccine, and hopefully we obtain our vaccine, you know, relatively quickly. But does the state of New Jersey have a game plan on how you're going to distribute that vaccine? You know, one thing that we see with COVID is like low-income minority communities are very strongly affected. You know, are they going to get the vaccine? You know, how are you going to distribute that? Has that discussion taken place at any level? Hopefully, when we get this vaccine.
So great question. I think the simple answer is it has not taken place, certainly at a state level, because the state doesn't even know what it's going to get in vaccine. I mean, there certainly is discussion on a national and international level of making sure the vaccine is distributed equally and fairly across the world. But do you give it first to high-risk people, or do you give it to high-risk countries or rich countries? The U.S. as a rich country is trying to buy a disproportionate access to the vaccine within the country. Do you give it to high-risk people or to low-risk people? How do you define high-risk people? High-risk people should include healthcare workers, should include the elderly, but it should also include people of lower socioeconomic status, because exactly as you said, they've been hit harder by this disease than other people. And so the people who should be the highest priority for the vaccine in many ways are exactly the opposite of the people who have the insurance to be able to get the vaccine. I think ultimately it's going to depend on what vaccine is there. So simple answer to your question, is it being widely discussed or decided? Not that I know of. But ultimately that a decision has to be made, but it's going to depend, especially given our government in Washington, on who owns the vaccine, who developed the vaccine, who paid for the vaccine. If it's a private company, where are they going to make the most money? Unfortunately, that may enter into a lot of it. The good news is people, the federal government has been de-risking, is the term, a number of the vaccines. So the leading vaccine candidates, the Moderna vaccine, the Oxford vaccine, the Johnson vaccine, the feds have paid for the first bolus of vaccine upfront. So even if it doesn't work, the feds have paid for it so that the companies would produce it now before they know whether or not it works. What it means is the feds should own access to it, because they're spending billions to have the companies manufacture. But we're not privy to what those contracts are, and you know, it's going to be up to ultimately the federal government to decide where it goes, and we're going to need advocates like you to make sure that the people who need it most are the ones that get it.
Wow. Wilhelmina Holder is one of our leading advocates in education in the community. She's also one of the founders of the Abbott Leadership Institute in Rutgers. Ms. Holder, you have any questions?
Yes, good afternoon. Thank you, Dr. Strom, and all the COVID survivors. The question I have has to do with parental rights. There's some parents who are indicating that they will not give their children the vaccine. How will that impact the rest of us in the community, if it will?
It will. And let me take it one step further. Kids, as you're alluding to, obviously are an issue, broader issue in terms of education and schooling, and what do we do in terms of reopening the schools. But in general, there is a growing large number of people in the public who are what we refer to as anti-vaxxers. They don't believe in vaccines, and they won't take vaccines for themselves or their kids. And that will affect all of us, because you don't develop herd immunity, assuming a vaccine works, assuming it can be developed, assuming it works, assuming antibodies work. It requires 50 to 75% of the population to get it in order to be able to develop herd immunity. Otherwise, you protect yourself by getting the vaccine, but you don't protect the entire population unless you can vaccinate 50 to 75% of the population. So if there are a lot of people who refuse to get this vaccine, it will mean this disease will not die out. It will continue to go on. It'll continue to spread. People who get the vaccine may individually be protected, but it's not going to protect the community, because there's enough people who are out there that they can still give the disease to. That'll be a problem. So yes, you're absolutely right. People will not be forced to take it if they don't want to take it, whether for their children or for themselves.
Thank you.
Felicia Simmons is a leading advocate down in the southern part of Jersey. She has been very vocal in terms of her advocacy role, and has been looking at solutions in her community. Felicia, are you still on the line? All right. Why don't we ask John Smith to give us an opportunity to hear from him in regard to the advocacy role that he feels is really important, that we should be identifying with. John, would you like to share with us some of your ideas? John, you're on mute. Do I need to unmute you?
Yeah.
Oh, okay.
I always have questions. Educators always have questions. So, it's a blessing to be on with you, three survivors, and there are just so many questions to be answered. What is, they're talking about a second round that hit us like that it did early in the year. Those questions still has to be answered. But I was wondering, the earlier you get diagnosed and start to get treatment, is it better to get early treatment as soon as you have some symptoms? Should you be reporting to your doctor, the hospital, just to get treatment? And the second question is the percentage of persons who fully recover. The three survivors on the program today all have some after effects. Are there some persons who fully recover and have no after effects?
So great question. Is it important to get an early diagnosis? Yes, mostly so you don't spread it to other people. Does early treatment do better than later treatment? We have very few treatments. So the answer is no, at least now. Once we develop more treatments, hopefully that will help. But the treatments that we have now, and there are now two, and with a third that might be the case, the two that work have both been tested in late stage disease. Taking them earlier, remdesivir, there isn't enough of it. So it'll only be used in late stage disease. And remdesivir also needs to be given IV, so it can only be given in a hospital. Dexamethasone, which is the other treatment, the corticosteroid, that's widely available, cheap, easily available, but it's only been tested in late stage disease. So there's no evidence that early stage disease is better. and there's reason to think it might be worse, as I was alluding to before, if you give it earlier, because it may suppress people's immune system. So is it good for the patient to diagnose it early? No. Is it good for everybody around them? Yes, so that they don't spread it to other people. Your other question was about recovery. The striking thing about this disease is 30% of people who get it are completely asymptomatic. They don't even know they got it. Another 50% of people who get it, it's a mild condition, it's a cold, and it's nothing more than that. And then there's a remaining 20% who get it and are seriously ill. Of those, so 5% of the total get hospitalized, are sick enough that they need to be in a hospital, and somewhere on average, maybe 1%, not in the US, but on average, maybe 1% die. So they clearly don't recover, the people who die. Now of those who don't die, our hope is that all of the others will recover, but it is too soon to really know. There are certainly people who have dramatic stories, like the 3 survivors we heard about today, who are still suffering from this disease. And our hope is they will all recover and be normal. But there's no guarantee yet, because it's too early in the course of the disease to know that for sure.
Well, it's interesting. We should be a little proactive about this, doctor. And I hate to ask you a loaded question, but that's my forte here lately. When we talk about individuals who have accelerated comorbidities, and many of them are going to be permanently disabled from it, when we hear Kendra, who's telling us that her ailment led to now dialysis, which is not a reversible situation. And when we talk about the issue that's happening with Christina, where it seems that she's going to have a disability that's going to have a tremendous impact on her lifestyle, shouldn't there be some kind of priority in terms of medical attention or financial attention or something given to them in this situation?
Well, medical attention, well, hopefully they will still, especially Christina's situation, will still recover. I certainly wouldn't give up. It is early.
So you've seen some people who have recovered?
Oh yeah, lots of people recover.
I mean, so maybe even more extensive?
Yes, and no question.
All right.
Yeah.
I would just say that I'm sorry, my husband, who was also very critical when he was in the hospital, he is completely recovered. That kidney came back.
Mm-hmm.
That transplanted kidney is now normal. And so he was on dialysis for about 6 weeks.
Really?
Release. Yeah.
Okay.
And now, perfectly fine.
Yeah. So I wouldn't give up. It's still early. People can still recover.
Well, let me look at it from this perspective then. And I know that today I kind of like pack the panel with women. I mean, that's my thing. But what about men? In terms of relationship of people who have been able to overcome this, and as Professor Wilson explained to us, that her husband has kind of almost fully recovered, but we have women that are still telling us that they're discouraged over ailments like sciatica. I mean, things that really create problems. Hair loss. Come on. Are there any relationships of ways in which we have been able to monitor this to tell us, is there an equity pattern here of change that will happen in their life?
Yeah, well, from a short-term point of view, men are more susceptible than women. In terms of your question about who's more likely ultimately to recover, we don't know yet, because this is all too new. So it's men are more likely to get sick from it. Men are more likely to get more sick from it. But once you've recovered from it, are men more likely to recover, or women more likely to recover? We just don't. It's too soon. We're just seeing the results now of data testing and confirming who are high risk of getting the disease. It's too early in the disease to know about recovery. I mean, our hope would be our 3 survivors from today will all recover. We don't know yet. But certainly there are plenty of people who recover. Again, 1/3 of the people get the disease never even knew they had the disease. And then another 50%, it was just a cold. So, but even people who get sick, most do recover. It just takes a much longer time than people think. People think of it as the time you're in the hospital or in the ICU or on the ventilator. and it's a much longer course. If you get sick from this, it takes a while.
Well, as we're entering our conversation, I just want to know if there's anyone on the panel that have any questions or anything.
I do.
Yeah,
I'm sorry.
yeah,
Right.
go ahead,
Okay,
Professor.
so we'll start with
yield.
Professor Wilson. Of
Yeah.
course, we're going to start with Professor Wilson.
That's not going to help your grade. It's not going to help your grade.
All right. Sorry. Yeah, I have one more question because my time is sort of, I got to leave in a few. But I'm, you know, a lot of people say I'm just asking for a friend. I really am asking for a friend now. Is it possible that people that I know actually had COVID maybe as far back as November and December?
It's possible. We just don't know. So I'll give you an anecdote. My wife and I were in Asia in December, and we got a very bad, unusual cough.
Yes.
That felt very much. COVID didn't exist as far as we know.
Right.
And it's, you know, come January it became public. Come February, antibody tests became available. So late February and March, we got antibody tests to find out, did we suffer from COVID? In December, the antibodies were negative. We said, oh, I guess we didn't. Except now we know antibodies don't last that long.
Right.
And so it's possible we had it also. So is it possible people had it in November, December? With, you know, it was known about worldwide in early January. If you look at the models, it suggests it existed probably at least as early as November. When it came to the US is yet another story. So it existed probably in China as early as November. The other thing is it seems the strain that the US is infected with came via Europe.
Right.
So it wasn't directly from China. So is it likely that somebody was infected in November in the US? Probably not likely, but it's certainly possible.
Wow. Professor Smith? It's a beautiful thing to have all these educators on the panel.
Yeah. Dr. Strom, what is the condition of the medical community, you know, in the state of New Jersey? I know that you are probably in contact with all of the medical professionals in the state. What is the state, and are there enough doctors in the medical community to deal with a second strain of this virus if it comes later on in the year? What is the state? You know, how are we doing?
You don't mean if it comes, you mean when it comes.
Okay.
I think the healthcare community in this state went through incredible stress. A lot of people got sick, healthcare workers. We did not have enough protective equipment. We still do not have enough protective equipment. The healthcare community is trying to stock up on protective equipment now, anticipating the next surge. And we can't buy enough to stock up, in part because other countries needed it, and now because Texas and Florida and Arizona and so on need it. So we have enough to meet our needs now. We don't have enough stocked up if another surge came, like what happened in the spring. We were clearly at tilt in the spring. We never were in a situation where we had to, I'm proud to say no patient in New Jersey ever died due to lack of a hospital bed, lack of an ICU bed, or lack of a ventilator. But we came awfully close in a lot of the state, the northern part of the state in particular. And with that, the healthcare community has PTSD. I mean, it is an incredible stress. I mean, things were so bad. We, for example, in Newark, were asked for, Rutgers was asked for parking lot space for body bags because there weren't enough places for body bags in the hospital. University Hospital was filled with nothing but COVID for weeks at a time because there were so many people who were sick. And as a healthcare worker, you see all these people who die. We're trained to save lives. And it's an incredibly stressful situation in order to be able to watch these people die and to watch them die alone because their family, their loved ones couldn't be with them because of isolation. And so it's an incredibly stressful time. So how's the medical community now? It's sort of recovering. I guess is the best answer. If we went through a surge as bad as the spring, I think it would be a breaking point. But hopefully we'll never get that bad. There will be additional waves. There'll be an additional surge within a few weeks. Based on what's happening in the rest of the country, it's not going to wait for later in the year. People are talking about flu. This will be a mild flu season because everything we're doing to protect against COVID will protect us against the flu as well. So flu will make it worse, but it'll be a mild flu season. But we're going to be hit by another surge within a few weeks. And, you know, we just need to count on our public and our leaders to be able to continue to do the right thing so that as the surge picks up, because of people on the Jersey Shore and people in bars and people in from other states coming in and not following the quarantine, we'll slowly lock down again. And hopefully, again, we'll do this, you know, as I was saying before, we will lock down before we ever get as bad as we were in the spring. If it gets as bad as we were in the spring, the healthcare community, again, keep in mind, we had an open bid in New Jersey for any physicians anywhere in the world would be given immediate licensure to treat people because we didn't have enough people. We graduated our medical students early to go out in the workforce. We graduated our nurses early to go out in the workforce. We graduated our pharmacists early to go out into the workforce in order to help. It was at that much of close to tilt. And now people are suffering from the PTSD to go with that. So, you know, hopefully it'll never get that bad again. It will be in Florida, it will be in Texas, it will be in Arizona, but hopefully in New Jersey, we're smarter than that. It's never going to get that bad. And we'll be able to handle the following surges, not one surge, there'll be multiple, but it's hopefully they will never be as bad as what we went through before.
Yeah,
I have another short question.
We're a tad bit over time, and I don't want to take advantage of those who would have to leave within the hour period, but we will continue this conversation as long as everyone wants to stay online. Mr. Smith.
Yeah, I just, since you mentioned, you know, University Hospital and the medical school, is there a correlation with the medical school and University Hospital? What's the correlation?
Oh, we're separate institutions, but we work hand in glove. So we provide the physicians that staff the University Hospital. So again, they're separate institutions legally, but we're great partners. And governance wise, I'm on the board of University Hospital, for example, as well. So and there are 4 Rutgers representatives on that board. So we work hand in glove. Sharif El-Nahal, who's the new CEO, I was part of choosing. He's fantastic. Yeah, the hospital did a great job with COVID. But again, we are the medical school's physicians are the physicians that provide the care at University Hospital.
Any other questions? Anyone?
Christina?
Sure.
First, I'm going to give you a little backstory. My parents work in the funeral business, or my father formerly did now. And this was one of those things that, you know, I even worked in the funeral home. I know how it works. But hearing the numbers was absolutely alarming. Do you think that we will see that again? I mean, at the place that my father worked, he was an operations manager in charge of 13 locations. At his location and at the other locations, he had 6 refrigerated trucks. He also had them at the crematory. The crematory's, you know, queue for the week was over 600 bodies, and that's absolutely horrible. It broke my heart hearing this. Unfortunately, do we need to expect something like that again?
Yeah, people don't realize how bad it was. There were more people, and Governor Murphy talks about this, more people died in New Jersey during those 3 months than in all the wars of the U.S. put together except World War II. And many years of wars, lots of wars. In 3 months, more New Jerseyans died than that. I mean, the number of people who died was just astonishing. So will we see that? Hopefully not in New Jersey. They'll see it in Florida. They're going to see it in Florida in the next few weeks. They'll see it in Texas. They'll see it in Georgia. They'll see it in Arizona. Our leaders are smarter, and our people are doing the right thing. And as long as the people keep doing the right thing, it'll never go back to being that bad. We'll see more deaths than we see now. Now it's strikingly low numbers, But, and again, just to give you a sense of scale, the federal government in the CARES Act gave extra money to hospitals that were hard hit. They defined hard hit. Did they ever, in total, in history, see more than 100 patients? University Hospital in Newark, just by itself, was well over 100 patients at one point in time for weeks. It was treating, it had over 100, I remember right, 250 patients at one point. At one point in time, the federal government considered hospitals the hard hit if they ever not treated 100 patients at one time, but through their history. And University Hospital had so many more. It was horrendous. And hopefully we will never get that bad. But it will be worse than it is now. But hopefully it'll never be that bad as long as the public.
Yeah, I absolutely hope so. I mean, it was terrifying hearing those numbers. It broke my heart. And I mean, as well as the healthcare workers, I'm so thankful for them. Like, I would not be here if it weren't for them and everything that they are doing, but I feel horrible for the people who do work in the funeral services because, this was heartbreaking for them as well. People could not say goodbye to their loved ones. This is absolutely horrible. And I really wish that this would just go away.
Unfortunately, that's not going to go away so fast.
No.
This is a new normal, probably for a good while.
Yeah, unfortunately.
Wow.
Glenn,
Yes.
Robert is here.
Hey, Robert.
Hey, how you
Really
doing?
a pleasure.
Yeah.
We're really working in the capacity of being able to hear as many individuals as possible, as long as I can have Dr. Strom's attention. Would you like to share with us your story?
Sure. No problem. I think it was April 14th. I was not feeling well. I had called my doctor. He had immediately told me to go in and get a test. I got a test on April 15th. April 16th, I was told I was positive. I had to go in quarantine for 14 days. I went in quarantine for 14 days. At around the 12th to 13th day, I started feeling worse. I went into the hospital then on April 20.
I think it's 26.
I think April 26th.
Yeah.
And I stayed in the hospital from April 26th to May 15th. Now, during that time, also in February of 2019, I was a recipient of a kidney transplant. And the COVID virus actually stopped my kidney function. So I had to actually go back on dialysis for almost 6 to 8 weeks, 3 times a week. Thank God that it finally subsided, and it went twice a week. And last week was the last time I had to go one time, and so now my kidney's back to at least functioning.
Wow.
But at that time, that's what I had to do. Fortunately, I didn't have to go on a ventilator. But during that time, it just was scary. It was just being there, not knowing that whether you would come out or not. And then after I got out, finding out that the highest mortality rate for people that were going in with COVID were transplant recipients.
And you were one of them. Wow.
Yeah. So I was kind of
amazing
that I got out. But, you know, it was all together, it was just a very scary situation because you're in there and they're telling you, everybody's telling you, well, the people that's most affected is the ones with an immune deficiency. And I knew I had that because I was on rejection medication for the kidney transplant. You know, not being able to breathe, sitting up there, not being able to move around, you know, not even be able to, you can't even walk around in your room, you know, wow. and you know, you sit there and you, not only do you feel, especially being put on a ventilator, you know, people, they're being sedated and you really don't know that you're on a ventilator, you know, but having to be in a hospital room every day, being awake, being aware of what's going on, and not knowing whether you're going to walk out of there or not.
Wow, the isolation.
It's true horrible.
It
I
was,
think being awake was a lot worse than being asleep.
yeah, basically, that's what it was. You know what I'm saying? It
Yeah.
was, because this is what you see. You see everybody coming in every day, and what was kind of irritating for me, not to knock any medical people, but what was irritating to me is that the doctors were too proud as doctors to say, we don't know.
Mm.
That's what really upset me. They just coming in, they're telling me, oh, well, this, he okay, give me a thumbs up. You
Wow.
feeling okay? Good, okay, but you're not telling me. But if it's okay if you don't know. If you'd have walked in there and said to me, Mr. Roberts, here's what's going on. We got this COVID thing is happening. We really don't know what's going on. We're trying to do everything we can, and everything works on a day-by-day basis. And as we go along, we're learning too. I would have felt much better.
Wow.
But by them not even, just trying to say, well, I'm a doctor, but not wanting to,
Yeah.
if you don't know.
Just trying to keep you emotionally up.
And then that made me stir crazy. They
Let
changed.
me ask you a question in the
Uh-huh.
interest of time, because we do have a priority in relationship to that. Do you have a question for Dr. Strom?
Yeah, Dr. Strom is here.
Yes, I do. I was just asking why. My question to him would, why would why would the doctors just not say to someone and be straight up with them and say, we don't know, instead of always trying to give you a runaround and not really tell you what's going on? Instead of saying, I don't know. I mean, that's easy enough to deal with. We can understand it. You don't know everything. We all know that everybody doesn't know everything.
I agree with your question. I think people don't know they should admit it. Sometimes people have a hard time with that. Sometimes they're afraid that the patients may feel worse if they don't know, that they'll feel reassured that if the doctor knows everything. This is a new disease. There's a whole lot we don't know.
And that was my point. All I'm saying is straight up, okay, we don't know.
Well, here it is. We're going to look at an opportunity, Mr. Wilson. You and your wife have agreed to be a part of a documentary. We're going to get more involved and have a little bit more conversation about this. Today, I just really wanted to bring a forum and a way in which we can invite the community to understand exactly what's important. We have people that are in our neighborhoods, that are in our lives, that are being affected by it. And we got to understand exactly how we have to work together to get this message out that we need to be part of the solution. And being part of the solution is, as Dr. Strom indicated earlier, that we have to be obedient to what our medical professionals are telling us and to what our elected officials are telling us. And we want to be able to put that message out and be a part of the solution. So I want to thank everyone for being a part of this conversation, this dialogue today. It's been very informative. I'm sure that there are a number of other areas that we're going to have an opportunity to be able to delight ourselves with and trying to understand more, because I do have a few more questions, but I'm going to end today's conversation right now at this point with the fact that it is very important for everyone who has been involved with understanding the priorities that we have to deal with at this time. And the most important priority that we have to deal with at this time is to make sure that you wear your personal protective equipment, that you get tested, and that you share these things that are going on with you with members of your family. It's important that social distancing is what they have asked us to do, but we have to stay socially involved, because without the social network that we have today, without the people that we're able to reach out to, Kendra out in Pennsylvania, Christina, and the Wilsons, we would not have been able to present to you today a real concrete method of getting an idea of how important it is for people to know what's going on. Please, 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 if you haven't been tested, go get tested. And if you have been tested and you find yourself in dire urgency to have a need to get more attention, do it right away. I want to thank everyone for being a part of this panel. It's been very encouraging. We're going to look forward to more of them. And This is the Image Profile Report, and I'm your host, Herb Glenn. And we will be back on Tuesday at 1 o'clock so that we can continue to raise awareness about issues that are important for our community. Thanks to everyone. And I'd like to say I'll talk to you later on.
My
Thank
pleasure.
you for
Take
having
care.
me.
So much for
Thank
having
you.
me.
Thanks for having us.
Thank you,
Dr. Strom, do you have a private practice?
No, I do not.
No? Okay.
No, I'm at the university.